Joining us right now is one of this year's Weezie's Angels, and it is Pablo Alaniz, who is a nurse over there at Methodist Children's Hospital. First of all, congratulations.
Thank you.
A lot of nurses do it because it's the passion that's kind of in your blood, but what's it feel like to be honored like this?
Uh, it was, I don't know how to explain it. It was a big surprise when they first told me I was nominated for an award. I thought it was maybe like Employee of the Month, just something like here in the hospital. I didn't think it was going to be this big, and later on I found out that it's a whole lot bigger, and I'm very honored to be nominated and to receive this award.
So you're right in the thick of things. We talk about the frontline workers, and we see it in the news all the time. And you are one of those right in the middle of COVID and dealing with children. What's that like?
Um, it's difficult at times, but the hospital's always provided all the proper gear that we needed. Luckily, most of the kids that I've taken care of haven't been as sick as the adults where they're here for weeks on end, you know. But when it all came up, and I told them I'd volunteer, I'd be here, and for me, I love nursing. I picked it for a reason to help people, and kids are really resilient. That's why I picked children's, and they recover faster. They uh, they want to get out of the hospital. It seems they usually do what you tell them to do so they can leave.
unlike the grown-ups, right?
Yeah.
Okay, you said you volunteered for the COVID unit. I mean, you're jumping into the fire basically.
Yes. When we started hearing about COVID on TV and stuff, my wife looked at me and uh, she knew I was going to volunteer. She's like, I know who you are, babe. I know you want to help kids. I know you're going to volunteer to do this. We just had to take precautions to be as safe as possible. And we do. I know all my scrubs come off in the garage. I go straight to the shower. But yeah, she knew once we heard about all this stuff coming to over here that I was going to volunteer myself to take care of these children.
So there was no talking you out of it on her part, right?
No.
She knows you too well, right?
Yeah, yeah.
Where do you get your passion? I mean, how do you explain that passion to somebody?
I don't know. Maybe it was just the way I was raised, or I've I just love helping people. I've always liked helping people, and that's why I picked nursing to help people in need. I don't know how to explain it, how it comes, or anything like that. It's something inside me that I want to help and make people better. And this is the best way I knew I could do it.
When it comes to COVID, you are, like I said, you're right there. What advice, what can you tell people about it, about what they should be doing?
Um, Being cautious, like they say, wear your mask, wash your hands, use hand sanitizer, try to stay 6 feet apart. It's very tough, especially being so long already, and you want to go back to normal. But I think just doing all the right things, like wearing your mask and washing your hands and being safe, try not to touch your face, um, is the best way to protect yourself against this virus.
The Louise Batz Foundation is all about patient safety, and that's what you advocate, patient and non-patient. Just be safe, right?
Yes, yes. And the hospital does a great job about doing that. Where when we have COVID kids, we have them separate in another unit, and we don't take care of anyone else but COVID patients. In the very beginning, it was really nice, only having one patient at a time. I was like, oh man, this is real sweet, just one patient. And there's times where you take care of two or three. Um, at least on the pediatric side, I'm not sure about the adults, but on the pediatric side, you're taking care of two or three patients at a time. It, it wasn't super difficult, but just trying to gear up and be prepared and do everything the right way, um, and being sure your fellow nurses did everything the right way too. That was probably the toughest part.
Okay. Anything else you'd like to tell folks?
Be safe. Hopefully this will end soon and we can go back to normal. We know what normal is anymore, and that's about it.
Well, congratulations.
Thank you.